Social assessment. Social assessment is a broad concept encompassing and many aspects of an older individual's life. It includes assessment of functional ability, as measured by the ability to perform the basic activities of daily living or ADLs and instrumental activities of daily living, social functioning, the older adult's social network and support system, the need for supportive services, screening for cognitive function, and an assessment of psychological well-being. For example, the mood, quality of life, and life satisfaction. Social assessment provides a snapshot of the resources and risks related to health and wellness experienced by an older patient, regardless for whether an older person lives in the community or in an institution. Support the social assessment includes evaluation of living arrangements. Describe typical daily activities like hobbies, leisure activities, socialization activities and contacts, pastoral or spiritual activities, and driving activities. The caregiver and support systems. Many caregivers of older persons are themselves older, typically a spouse or adult child, and support from the family and friends, and for many of these constitutes their sole source of support, and marital status, social history, educational and financial status.
Exchange model of social assessment. The exchange model has been utilized more and more by care organizations. The exchange model emphasizes the importance of independence and quality of life when establishing needs, and though is a person-centered activity. The UK Care Act 2014 underscores the right of individual to have a needs assessment and stipulates that local authorities must carry out an assessment of anyone who appears to acquire care and support, regardless of their likely eligibility for state-funded care. Focus the assessment of the person's needs and how they impact on their well-being and the outcomes they want to achieve. Involve the person in the assessment and where appropriate their career or someone else they nominate. Provide access to an independent advocate to support the person's involvement in the assessment if required. Consider other things besides care services that can contribute the desired outcome. Use the new national minimum threshold to judge eligibility for publicly funded care and support.
So next, social function explain a person's overall function in many aspects of daily living activities, including independent life, employment, social interaction, and leisure time. And social function defined as activities of daily living. This is a term used by healthcare to refer people's daily self-care activities. So healthcare professionals often use a person's ability or inability to perform activities of daily living as a measurement of their functional status. So, hindi lang naman po mga geriatric patient ang mayroong social function because different generation has different activities. So, for example, for the Gen Z, these are those individual focusing on gaming or studying. So, as a student, dito tayo naka-characterize. Then, for the next generation is the millennials or the Gen Y. These are those individual focused on generating fund through workplace. And for the Generation X, these are the individual learn the value of independency and work-life balance. And for the baby boomers, these are the individuals spending time with their family and friends. And for the last generation is the traditionalists or the silent generation. These are the individual consuming print media than social interaction. So next, social function is correlated with physical and mental function. And that's true. Dahil ang social function natin is nakadepende sa physical and mental function natin. For example, our mental function providing information sa gagawin ng body natin. And the work of our body is gawin yung mga natanggap niyang message from our mental function. So kapag nagawa ng katawan natin yung daily activities natin, like walking, eating, social interaction, that's called social function. Because nagawa natin yung mga activities na gusto natin gawin. In addition, mental function works cognitive process or activities such as thinking or reasoning, while the physical function works for range of motion, muscle strength, reaction time, mobility, transferability, and sensation, and also the visual skills. So if our physical and mental function works, it will satisfy our social function. And next, an individual's social well-being may positively affect his or her ability to cope with the physical impairment and ability to remain independent. And that's the reality. Adjusting to life with disability can be a difficult transition. They need a lot of time to accept the situation, but before they can accept their disability, they need first to grieve because they suffered major loss, not just loss of their healthy body and unlimited body, but likely loss at least some of their future plans.
A satisfactory level of social function is a significant outcome in and of itself. So, a satisfactory level of social function is one of the most important and valuable components sa health ng older adults. So, kapag na-reach ng isang older person ang kanyang satisfactory level of social function, na maintain niya ang kanyang health and well-being. And because of that personal satisfaction, mas nagkakaroon ito ng effectivity sa kanyang social engagement and consciousness. Then next, the quality of life an older person experiences is closely linked to social function dimensions such as self-esteem, life satisfaction, socioeconomic status, and physical health and functional status. So, yung quality of life ng isang older person ay nagko-contribute sa kanyang social function tulad ng mga nabanggit kanina. Siyempre, kapag may social participation ng isang older person, nabibuild up ang kanyang self-esteem at ang kanyang life satisfaction. And kapag nade-decline ang social function dimensions ng isang older person, it will affect their overall health and function. So, if there is a satisfactory level of function, all of those dimensions leads to health promotion and self-efficacy.
Impact of social functioning on health and well-being. Social relationships such as marital status and friendship networks influence the practice of healthy behaviors such as physical activity and dental visits, where dissolution of marriage or weaker social networks are associated with lower level of healthy behaviors such as smoking and alcohol use. So, a large body of research po is the impact of social functioning on health and well-being of older adults. Research on older adults in several countries, it has found that social isolation and loneliness are associated with increased mortality. So while the multiple studies po have found greater level of social support that related to better self-management of diabetes and dietary and exercise behavior. So they suggested that important step in increasing the survival of patients after a cardiac event might be more through monitoring of patients with low social support to improve compliance with medications and adherence to healthy behaviors. Most older patients receive some level of care and support from family and friends, and for many, this constitutes their sole source of support. So, dito po is caregiving for older persons or patients with limitations in ADL, chronic illnesses, or dementia is physically and emotionally challenging and has been documented to have serious and adverse physical and mental health consequences. Ito po yung declining health and increased mortality among older caregivers. So, yung experience po ng caregiver can result in impaired ability to provide adequate care to older patient and naglilid po siya sa medication errors, elder mistreatment or neglect, and family conflict. Therefore, including an assessment of an older adult's ADL and IADL functioning, social functioning, including met and unmet need for services, and status of the caregivers are critically components of social assessment.
Aspects of social functioning and assessment tools. Social function is a multidimensional term widely used to describe the social context in which an individual lives. This includes concepts used in literature such as relationships, social adaptation, and spirituality. Assessment of social function can be based on personal prejudices and values. Example: assessment of doctors and the elderly. These aspects are necessary to protect the elderly from social isolation. It also includes the awareness of doctors who influence the amount of social support and the size of the social network. Satisfaction with one's social support can be influenced by one's life experience, personal values, group membership, self concept. However, physicians need to identify only older people who have been identified as the risk of social isolation. Social networks. It is an aspect of social functioning that describes a personal web of social relationship. It is also an objective concept that quantitatively describes a person's combined social relationship instead of focusing on more subjective considerations such as person's feelings about the quality of these relationships. Aspects of a person's social network include size, it is the number of people considered to be part of the network. Next is density, it is a connectedness of the members. Next is boundedness, traditional boundaries that define group memberships such as family, neighbors, and church. Next is homogeneity, it is the similarities of members. Next is frequency of contacts, it is the regularity of members' transactions. Next is multiplicity. It is a single or multiple transaction between members. Duration, how long members have known one another. And last is reciprocity, the extent of which transactions of the members are reciprocal. A person's social network can be further understood as a social relationship that exists along a continuum or intimacy, often referred to as a primary and secondary social relationship.
So, in social support is defined as the tangible and intangible assistance derived from an older adults. Social support may be given in the form of the following. So, number one is the emotional support, which is give love and caring, most often provided by the family member, spouse, or close friend. The numbers two is instrumental support, and then the three is appraisal or informational support. So, in other words, social support is similar to the concept of a social network. So, a physician does not need to master all the concepts included in the description of social support. Instead, a physician could condense this knowledge to identify patients who may be at risk of adverse health outcomes or premature institutionalization. It is due to inadequate social support, and one approach would be to ask patients to identify the types of help they need in ADLs and IDLs. And then it is find out who is available to offer the appropriate assistance for these things, and determine who is able to step in this person become unavailable. So, and if the patient is independent in all ADLs and IADLs, the most appropriate approach would be to pose this question hypothetically. Another approach is for physicians to use an evidence-based screening tool to screen for patients who may need additional interventions from the geriatric team. And then there are many screening tools that may be appropriate for this purpose, such as the social support questionnaire, and then the interpersonal support evaluation, and then the MOS or the Medical Outcome Study, and then the Social Support Survey. So, in short, instrument developed for use in medical setting is the ESSI, which is a 7-item self-report questionnaire. The ESSI was developed to examine the relationship between social support and cardiovascular disease. Cardiovascular disease outcomes because lower levels of perceived functional support and network support have been found to associated with increased mortality and morbidity among patients with cardiovascular disease. So, the ESSI measures a patient perception of his or her emotional, instrumental, informational, and the appraisal social support systems. Possible score range from 7 to 35, with a score at below 18 indicating poor social support. It is recommended that patients with a score at or below 18 on the ESSI be referred to a social worker for additional follow-up.